So today we'll be talking about HER2 positive breast cancer, and this is one of the 4 types of breast cancer. And at the end of this video, you will understand what HER2 positive breast cancer is all about. You would also be able to appreciate how it is a game changer when we apply targeted therapy. And lastly, we'll talk about the side effects and prognosis, and you'll be better armed with tools that help you on your journey. If we look at our statistics in Nigeria, in 2022, about 32,000 women were diagnosed with breast cancer. And because 20% of all breast cancer cases are HER2 positive, we can estimate that more than 6,000 Nigerian women in 2022 were diagnosed with HER2 positive breast cancer. However, the problem is that even though we are diagnosing women with breast cancer through histology, there are many states and many hospitals that are not asking for an important test called the immunohistochemistry test, or many women cannot afford to do the test. Yet, the immunohistochemistry test is compulsory. It is not an option. It is a compulsory test to diagnose women with the specific type of cancer that they have. It helps us characterize the breast cancer and predicts how the tumor will behave. Maybe it will be aggressive or not, and it helps identify the best treatment options. And so for us to know if a woman is HER2 positive, the immunohistochemistry test must first be done. Breast cancer is not one disease. There are 4 types of breast cancer according to the immunohistochemistry test, and that's what we are diving into. We will discuss HER2 positive breast cancer subtype specifically, the way it behaves, because if you've been diagnosed with HER2 positive breast cancer, you might be wondering that how does this cancer differ from other types? What does it mean? It's important to know that all breast cells have the human epidermal growth factor receptor, HER2. H for human, E for epidermal, R for receptor, and the number 2. These proteins are naturally responsible for how the breast cells grow and divide, how they repair themselves. They are natural proteins within the body. However, when a woman has breast cancer, sometimes the HER2 genes make the HER2 protein abundant in excess. And when these proteins are in excess, they produce excess cancer cells. And this can make the cancer even more aggressive. And that is the characteristic of HER2 positive breast cancer. It means that the normal HER2 proteins are in excess, and because of that, there are excess cancer cells, which can make the cancer quite aggressive. And when there are too many HER2 proteins, it makes the cancer cells spread or grow too fast. And this is very common. In about 20% of all breast cancer cases, women are HER2 positive. The good news is that we have treatment that can target the HER2 protein, can slow down how fast these HER2 proteins are being produced, can slow down how fast these cancer cells are being produced, so that we don't have excess HER2 proteins or excess cancer cells. At the end of the day, the goal for HER2 positive breast cancer treatment is to slow down how fast they divide, slow down the risk of the cancer cells spreading to nearby areas or to distant sites. Even though we know HER2 positive breast cancer can run an aggressive course, There are several life-saving treatments that have been introduced. And for us to reduce the aggressiveness of this disease, then we must introduce this targeted therapy that damage the HER2 protein. And that's the good thing about science and research. This targeted therapy are effective, and even the way we give chemotherapy is different for other subtypes. In HER2 positive breast cancer, there are certain chemotherapy that are preferred, and there are certain chemotherapy combination, drugs that we combine strictly for HER2 positive breast cancer. And there are specific targeted drugs that we give or prescribe, such as trastuzumab, which is also known as Herceptin, Perjeta, and other anti-HER2 drugs. At the end of the day, if we know you have HER2 positive breast cancer, we can target the HER2 cells and receptors, and we can give effective treatment that reduce the risk of reoccurrence, slow down the growth of the cancer cells, and improve your treatment outcomes. So even though we know HER2 positive breast cancer can be slightly aggressive, we now have effective medications that can improve the entire outcome. So I'll delve a bit more into the immunohistochemistry, also known as IHC. This is an important test that helps the cancer specialist in guiding the treatment, to make better decisions, but most importantly, to classify the breast cancer type. And we want to go right into the cancer cells to know what is driving or what is fueling the cancer. And based on this, we will use 3 markers to say you are this type, or you're this type, or you're this type, or you're this type. So what are the 3 markers? Estrogen receptor, progesterone receptors, and HER2 new receptor. These are the 3 markers we check for in the immunohistochemistry report. Also, these 3 markers tell us how to combine our treatment, but I'll talk about that later. Now, the immunohistochemistry checks how many HER2 receptors are on cancer cells. Remember, I had mentioned that HER2 receptors are normal cells that every female has. However, when there is an excess of HER2 cells in a breast cancer patient, then we say she is HER2 positive breast cancer. And so when we look at the immunohistochemistry report, we look at HER2. If it is 3 pluses, that means it's positive and there are excess HER2 cells. Breast cancer has 4 molecular subtypes. And I want to explain this as a garden with different types of weeds. Some weeds grow fast, some grow slowly, and some are affected by the different types of weed killers. So moving to the second type of breast cancer is what we call the HER2 positive breast cancer. This is when your receptors, estrogen and progesterone, are negative. This means that the cancer cells are not being fueled or fed by these hormone receptors, but the HER2 protein is positive. And that simply means that a lot of breast cancer cells are going to be produced. HER2 positive breast cancer, sometimes these cancer cells divide very fast, can be more aggressive, and so we must block the HER2 protein and slow down how quickly the cells are dividing so that we can reduce the risk of the cancer spreading. So the second type of breast cancer is what we call HER2 positive breast cancer. The third type of breast cancer is what we call luminal B. Luminal B means The three receptors, estrogen, progesterone, and HER2, are all positive. The breast cancer cells are being fueled by estrogen and progesterone. We must block it. And it is also being fueled by HER2, which we must target that protein and block it. And the only way we know these things are positive is because you have done the immunohistochemistry. This also tells us that for us to block these three receptors, we have to use two treatment modalities, the hormonal therapy as well as the target therapy. The fourth and final breast cancer type is the luminal A. And in luminal A breast cancer, this just means that the estrogen and progesterone receptor are positive, while the HER2 is negative. And so in this group of women, they will need hormonal therapy, but they don't need target therapy because they are HER2 negative. And all of this we know because the immunohistochemistry test has been done. So it's important that you know your immunohistochemistry report to know the subtype that you have. And whatever subtype you have, it's critical that you discuss with your oncologist and that your oncologist pairs chemotherapy, prescribes chemotherapy specific to your molecular subtype, as well as introduces targeted therapies if you're HER2 positive. Also, if you have a small breast tumor or early stage disease, you should have chemotherapy and target therapy before surgery. So a lot of times when we see breast cancer cases and it is, say, stage 1, sometimes we do surgery first. But if you are HER2 positive, we strongly recommend that you should have chemotherapy and targeted therapy before surgery. The breast sample that is taken during the biopsy or the sample taken after surgery is also the same sample that is used for the immunohistochemistry. So we are not taking a brand new sample. It is the same sample taken to make a histology diagnosis that we use for the immunohistochemistry. And a pathologist is the cancer specialist that looks at these tissue samples in the lab. And these tests usually take anywhere between 5 days and 4 weeks. HER2 positive breast cancer is considered aggressive because naturally HER2 cells are present in every woman's breast and they're responsible for cells growing. They promote cell growth in the breast. However, when there's breast cancer, there is an abnormal command that these proteins should become plenty, become abundant, become excess. And as they become so much, they command the abnormal cancer cells to become so much. And the more cancer cells are available in the breast, the higher the risk that they can travel far or spread. Targeted therapy is costly, particularly since most patients in Nigeria pay out of pocket, and affordability is a genuine concern. And so a brand navigator will work with you to explore the financial resources page on the brand platform. And on this page, you'll find different governmental programs that are supporting more women to access targeted therapy in Nigeria. So about 20 years ago, the biggest breakthrough for HER2 positive breast cancer was discovered. And it was the introduction of new drugs that target the HER2 protein. For a while, we knew HER2 positive breast cancer was an aggressive type of breast cancer, but there were no specific drugs available to target it. Now, these special drugs have been discovered and they are targeting the HER2 protein, and they are reducing how are reducing the aggressiveness of the cancer as well as stopping the cancer from growing so fast. And so the treatment outcomes are way better, and there are several drugs. And the first one is trastuzumab, also known as Herceptin. This is the first targeted therapy for HER2 positive breast cancer, and it's given through a drip. The second targeted therapy is known as pertuzumab, also called Perjeta. It's often used with trastuzumab as a drip, or sometimes it is combined in one injection, and this can be given under the skin. Another type of target therapy is the TDM1, which is also known as Kadcyla. It's a combination of trastuzumab and chemotherapy in one drug. It is used when or if the cancer returns after initial treatment. Another type of targeted therapy for HER2 positive breast cancer is a newer drug called tucatinib, also known as Tuxia. And it is prescribed when the cancer has spread to other organs, including the brain. And so for HER2 positive breast cancer, there are several targeted therapies that can be used to slow down the growth of HER2 positive breast cancer and achieve better control of this cancer. And so we are well aware that these treatments have transformed HER2 positive breast cancer from a highly aggressive disease into one that is highly treatable. And so you may be wondering, what about chemotherapy, radiotherapy, surgery, and other types of treatment modalities? Most HER2 positive breast cancer patients receive a combination of treatment, which include surgery, removing the tumor, and that may be a lumpectomy or a mastectomy. There's the role of chemotherapy, and specifically we use certain chemotherapy for HER2 positive breast cancer. We use it together with targeted therapy to shrink the tumor. And of course, radiotherapy helps in destroying any remaining cancer cells after surgery. Does targeted therapy cause side effects? Like all treatment, targeted therapy and chemotherapy have side effects. You may experience fever, and that is when your body temperature goes higher than normal, or you have chills, like you feel cold, and usually this is a sign that you are probably fighting an infection. Nausea, you may feel nauseated, like you feel like vomiting, or you feel sick to your stomach. Like you might throw up, but you don't. It's that uneasy feeling that makes you want to just sit still. Vomiting is another common side effect with chemotherapy and targeted therapy. Infusion reactions occur at the site where chemotherapy or target therapy is given, and this may appear as a change in color of skin or some skin changes around the area where these injections and drugs are administered. Diarrhea may occur. In some patients, this is when the stool is loose, it's frequent, or it's watery. And this is a change in bowel habits, different to what you usually, your usual bowel habits. In some instances, infections occur after administration of chemotherapy and targeted therapy. Other side effects include cough, headache, feeling tiredness or shortness of breath. As well as when we look at your full blood count picture, your blood levels, we may notice that your white blood cells are low, or your neutrophils, which are a type of white blood cells, are also low, or your blood levels are low. The side effects that we watch out for with target therapy are related to the heart. So before you start target therapy, your oncologist will assess your heart with an ECG and an echo scan. This effect on the heart is rare, but we always monitor the state of your heart when you are taking target therapy. One of the most important things you can do while on chemotherapy and target therapy for HER2 breast cancer treatment is to track your side effects. And while you're on the brand program, you will have access to the ProScare app. With this app, you can log your symptoms, you can report how you feel, and your medical team will provide clinical advice, and they will stay connected to you, letting you know the steps you should take in taking care of yourselves, as well as advising you to come in when you are required to.